it's literally there but for the grace of God go I on any given day.
This man takes a bus for 2 hours to work, he works a full day, and he can't afford a place to live, and I think this just is not fair.
It's much less expensive to house people. It's so much more economically responsible, and it makes economic sense in terms of how our society functions.
Heading Home Hennepin is not an organization. Heading Home Hennepin is an initiative. It's a community goal. It's putting hundreds of agencies together to work very specifically on a plan to end homelessness. The first goal in the plan is prevention. We know that we can't end homelessness without preventing it from happening in the first place. There are many recommendations around prevention in the plan, but there are two really key things that we need to do. We need to make sure that we can keep people in their housing whenever we possibly can. This has become more challenging, recently with the economic downturn and the foreclosure crisis, but we are still extremely focused on doing whatever we possibly can do to keep a family or an individual in the housing that they have. We know that's the smartest, best use of our dollars. We have a nationally recognized best practice here in Hennepin County called the Family Homeless Prevention Assistance Program. And this is a program where we get money from the state of Minnesota, and we can use these funds very creatively to work with families and individuals and do whatever it takes to try to keep them housed. It's sort of crisis intervention money. And that program has been very, very successful at keeping individuals and families housed. We did receive a doubling of funds from the state legislature, so we're able to serve more families, more single adults with a focus on veterans, and homeless unaccompanied youth for the first time with those dollars. And we're really seeing those dollars doing some good work. One of the things that was so important when we went to the state legislature to ask for more money for this program was to show that this is a very cost-effective program. And we know this from Hennepin County staff who run the program, that on average, it costs us about $500 to prevent a family from becoming homeless. Just one-time money. If we were to take that family and that had become homeless, and they were cycling through our systems and they were in our shelter system and we had to work to get them rehoused, it would cost us on average about $5,000. So we see with just one family the savings we can have, and certainly a much better use of our dollars to keep that family intact and together and housed. The other thing that's really important about our prevention efforts is that we need to make sure that people don't become homeless when they leave public institutions, like foster care and corrections. We know, for example, that about 70% of homeless unaccompanied youth in the state, and certainly in Hennepin County, have at some point been in a public institution, like foster care or juvenile corrections. And there's a huge opportunity there to work with those kids earlier in the system, so that when they leave and they age out of foster care or they are discharged from juvenile corrections, that the streets and the shelters aren't the answer for them, but that we've been working with those kids and that they have the skills that they need and the ability to live independently and be successful and safe. So that's one of the goals of our plan, is to really focus on those kids and work with them earlier and help them succeed when they leave. Hennepin County spends millions of dollars on foster care, and in our mind, working to help those kids transition out of foster care and into the community is just sort of finishing the job. We don't want to fall short of completing the job. If we do, we know those kids are very likely to end up in our adult correction system. So we really want to work with those kids and make sure that doesn't happen. So the next big goal of the plan is to create a much more comprehensive street outreach system. We're really trying to move away from a system that really focuses on a criminal justice response to homelessness and move to a social service response. This is an area that we really felt like we were seeing a big gap in our community. We had only a few outreach workers on the streets at any one time. We've got probably 350 to 500 people sleeping outside every night in Minneapolis. And so they were overwhelmed. They didn't necessarily have the tools they needed to not only work with folks, but then get them housed, which is our goal. Is not just to go out into the streets and provide supplies, although that's very, very important, But we want to take it to the next step and actually break their cycle of homelessness and get people into housing and support them and provide that safe and stable place for people to live. Monica Nilsson is the director of our Homeless Street Outreach Initiative at St. Stephen's. And she's been working in the field for many, many years, incredibly passionate and compassionate about this issue, and very, very smart about how she does her work. She's built a great team of outreach workers that are very competent to do this work. They're people who have been homeless themselves. They're people who maybe have suffered with chemical dependency or mental health issues, and they're the ones out on the streets connecting with folks directly.
We're here today under a freeway overpass. And part of our work is to work with people who are sleeping outside. Each night in Minneapolis, there are between 300 and 500 people who are unsheltered, who are not staying in shelter or transitional housing or couch hopping, staying with friends. We have, as Metro Transit reports, about 50 people each night riding the buses or light rail for shelter. We have many who are sleeping outside, whether it's under a bridge like here or in a car, or in an abandoned semi-trailer. We have others who stay up all night, who walk the streets, or who look for someone who might take them home and not exploit them. So those are the focus people that St. Stephen's Street Outreach works with. We also are a way to have a public response to issues of homelessness. We're part of what's called the Downtown Safe Zone Radio Link. That is a radio link between security guards, parking ramp attendants, the Minneapolis Police Department, the Target store, and others. And the idea is that when appropriate, St. Stephen's Street Outreach would be called instead of the police in order to deal with a homeless concern. For instance, if a gentleman is brushing his teeth in the drinking fountain at the IDS Crystal Court building, in the past, what do you think security would do? They would call the police. And what would the police do? They'd give him a ticket. Or perhaps your neighbor says that someone is sleeping behind their garage. What would your neighbor do? They'd call the police, and what would the police do? They'd give him a ticket. Perhaps you pass by a woman and she's swearing up at the sky or swearing at you or asking you for change. Out of fear or concern, you would probably call the police, and the police may give her a ticket. The goal is that when appropriate, St. Stephen's would work with those folks to get them housing, to get them care, and to improve their life situation.
The next big goal in the plan is housing, of course. This is the largest goal, the most expensive goal in our Heading Home Hennepin plan. And our goal is to create 5,000 new housing opportunities that will work for people at very low incomes. So not the typical affordable housing that maybe gets built in the community that was really for families of four that make $40,000 or $50,000. We're talking about people who make very, very little, and we're trying to create housing opportunities for them. And the way we're doing this is not just creating brand new units that we build from the ground up, but we're really working a lot with the existing market and building relationships with landlords and making sort of scattered site housing throughout the community work for the people that we're working with. So somebody who maybe doesn't have rental history or maybe has a criminal record on their background, who wouldn't be able to go out and get an apartment on their own. They're working with our community partners, and together, by building relationships with those landlords, they're sort of creating a win-win situation where the tenant gets the support they need, but the landlord also feels supported. And the key to this is making those units affordable, making the math work. The reason that people are homeless is that they can't afford a place to live. I know it sounds simple, but I think sometimes we focus on so many other things. We say, oh, it's because they're mentally ill, or it's because they're drinking, or it's because they have this issue, or whatever, all the issues that we can come up with why people are homeless. The bottom line is they can't afford a place to live, and that's why they're homeless. There are many of us in the community, the broader community, who are suffering from mental health issues, who do have chemical dependencies, who have these issues, but we're in housing because we can afford to be in housing, and because we have the supports most likely to help keep us there. And those are the two ingredients that are missing in the lives of people who are homeless. They can't afford a place to live, and they simply don't have the supports to help them stay there. So if we can tackle that piece, we can end homelessness. Housing itself is mental health care, and housing itself is physical health care. Once somebody's in housing, they're so much more able to get connected to those other services that will help them be as healthy and satisfied in their life as they could possibly be. The next goal in the plan is to help break down the barriers that people face when they're trying to get connected to the services they need to escape homelessness. People really have to go so many different places to get connected to services. They go one place to talk about their housing, they have to go down to a different place to work on their benefits, maybe they go someplace else for mental health care or physical health care, and it's basically a full-time job to get their kids the care they need, to get themselves the care they need. And so what we're trying to do is figure out a way to just make that system work better for people who are experiencing homelessness so that it's not such a barrier. And one of the ways we're doing this is we're doing an event 2 times a year called Project Homeless Connect. This is once again a national best practice. It started in San Francisco and quickly spread across the country. We were one of the early cities to start doing this project. And we started it in 2005 as sort of just a little pilot project. We thought we worked with the Basilica of St. Mary, and we opened the doors and said, we're just going to bring as many service providers as we can together and see if people come. We don't know if they'll trust this. We don't know if they'll really believe in this, but we're going to bring together housing providers and employment specialists and mental health care and physical health care and haircuts and shoe vouchers and everything we can think of that people might need to help them escape homelessness and put it in one place. So we did this in late 2005, and it was amazing. We outgrew the Basilica in the first hour that the event was open. It was people flooded to this event to get connected to services. So we knew we were on to a model that maybe was something that people were looking for. So we approached the Minneapolis Convention Center, and now they're partnering with us 2 times a year to put on this one-stop shop service event. And it's absolutely incredible. At the last event, we had 3,000 people, either experiencing homelessness or near homeless, come to the convention center in April to get connected to the services that we had there. We had 1,300 volunteers, community volunteers from corporations and faith communities, who all came together and said, we want to be a part of this day. And their role that day is to literally walk one-on-one with a guest who has come to the event who is experiencing homelessness and help them get connected to the services they need. And we had the services there, we had about 400 service providers representing a couple hundred agencies. We had on-site dental clinics and on-site eye exams and eyeglasses given out. Every kind of medical care that people could possibly need. A huge legal team headed up by Faye Green Benson that could address any kind of legal issues. We had housing teams and employment teams and haircuts and shoe vouchers and state IDs and birth certificates. And these are the kinds of things that, a state ID, if somebody doesn't have a state ID, that is a barrier to almost everything else they need to do to end their homelessness. And so our goal with these events is to just chip away at those barriers to make sure that when people leave that day, they're at least one step closer to ending their homelessness, if not ending it that day, which would be, of course, the ideal situation.
Emergency room care is extraordinarily expensive. Emergency rooms aren't equipped to actually remove teeth or actually take care of the underlying problem. Unfortunately, the only treatment that's available is drugs. So either antibiotics for infection and pain medications for pain. I'm Dr. Michael Helgeson, and I'm the CEO at Apple Tree Dental. And we're a nonprofit organization here in the Twin Cities, and we have programs up in the Red River Valley and down in southwestern Minnesota as well. And we're actually involved in the Project Homeless Connect up in Fargo-Moorhead too. So by providing primary care for people, it's just much more cost effective. Last year there was a story in Maryland about a 12-year-old boy named Diamante Driver who actually died from a dental infection spread to his brain. He was hospitalized for about 2 weeks, and despite all of that, they weren't able to save his life. So an $80 tooth extraction, this 12-year-old young boy would be alive. So it's not just about looking good. It's not just about being able to get a job because you have teeth. It's about being healthy and being able to stay healthy. And unfortunately, there's some 80 million Americans that don't have access to dental care. It's about double the medical access problem. So it's an area that really needs a lot of attention. So we're all set up here today, and we're working with some of our staff and then with a lot of volunteers from the Minneapolis area both dentists, hygienists, and assistants. And I think we have about 100 dental professional volunteers here today.
So the fifth goal in the plan is self-support, trying to increase people's ability to support themselves whenever we can. And this is through recommendations around education, increasing education opportunities, increasing employment opportunities, and helping people get connected to the benefits and income that they're eligible for. There are so many people on the streets and in the shelters who are eligible for benefits that they don't even know they're eligible for, or they don't have the person there to help walk them through what can be a very complicated system to help them get those benefits. Veterans are a really good example. There are so many veterans who are in our shelter system or on the streets who are eligible for veterans benefits, and they should get those benefits. So we need to do a better job of outreaching to those veterans and making sure they get connected. The Minnesota Assistance Council for Veterans is a great organization that connects with veterans. Hennepin County has a Veterans Affairs team, and their goal is to really work with those veterans, new veterans arriving from Iraq and Afghanistan, new veterans who are becoming homeless, try to connect with them and really get them off the streets as fast as we can, get them connected to the benefits that they deserve and have, of course, earned, and make sure that they're escaping homelessness as fast as they possibly can. The last goal of the plan is something that we call systems improvements, and it sounds sort of general and broad, but it's really all of those things that we can do in many ways without even costing any money, just ways of improving the way the system works and doing it doing government and business in a smarter way. So for example, there is a group of youth providers who've been working very hard on improving mental health care for youth. It could take 4 to 6 months for them to ever get an appointment to get a mental health evaluation. And they needed these evaluations so they could get connected to benefits that they were deserving. Well, simply by bringing this